ODing in the USA. The National Institute of Health's data shows more than 100 Americans will die from opioid overdoses today. Let that number sink in. 100 Americans will die from opioid overdoses today. It's a staggering number. Many out there are trying to stem the epidemic, including legislators, law enforcement agencies, courts, and the medical community. The president himself declared opioid addiction a national health emergency. But how about the armed forces? Of sorts. I'm honored to be joined now by two of our nation's veterans who served in the Army both as captains and medical professionals. As Pat Tillman Foundation scholars working on policy, they recently joined the fight against opioid addiction here at home. Leilani Ataleo is a family nurse practitioner and a doctorate of nursing practice student at George Washington University. And Matt Miklett, who is working on his doctorate, public health at Johns Hopkins University, also here with us today. Welcome to both of you. Thank you for spending some time with us. What was it that drew you to the Pat Tillman scholarship work?
Yeah, we were laughing about this on the way here, because it's a similar story of, how do we pay for grad school? And I thought I knew who Pat Tillman was, and it didn't take long in the foundation to start learning about who he was and what he cared about and his passion for the community and learning.
Now, tell me what sort of work you're doing now. And again, Leilani, I'll start with you.
My background was in public health. And so I worked in North Carolina on drug policy reform, specifically on overdose prevention and increasing access to the opioid antidote, naloxone. So while I was there doing policy reform, I talked to a lot of individuals that are directly impacted. And something that really struck a chord with me with one individual was she said she had an abscess on her leg because she had injected drugs, and she refused to go see anyone in the medical profession. She said people treat her bad. She just absolutely refused to go. So I met up with her. I couldn't do anything for her as a registered nurse, but I just gave her moral support and talked to her. And she really was the reason why I ended up applying for a family nurse practitioner school, because although I'm doing policy, I know this is something that I could bridge until people actually start adopting these policies that are evidence-based.
Gives you some work to be doing.
Right.
Yeah. Matt, how about you? What sort of work are you doing?
I think opioid epidemic was something I had trouble avoiding, quite honestly. My high school class, same old story. A lot of people are saying, a lot of people are dying. And I worked both in physical trauma for people coming back from Afghanistan, a lot of opioids there. And then I moved on to doing psychiatric care, so inpatient psych. So again, a lot of substance use. And these reoccurring themes kept coming up for me. And when I got to Philadelphia, seeing how bad the crisis is there, we have 4 times the overdose rate of New York. I really want to get involved. So I became a subcommittee member on the Philadelphia Mayor's Task Force. I also work for Health Economics Institute, which is actually based out of New York here, known as Cherish. And then through the Pat Tillman Foundation, I actually found these relationships. And with another scholar, I co-founded a nonprofit known as Action Tank, kind of breaking this idea that veterans are broken. And I think fundamentally that veterans' problems are people's problems, and that veterans are uniquely suited to address a lot of the community's problems.
I was struck by one sort of thought from you, and that is the idea that we talk about words matter. The idea that the words we use to describe these problems are important in working towards remedying the problems. What do we mean by that, Leilani?
There was a study published several years ago that showed that when trained professionals heard the term substance abuser as opposed to a person with substance use disorder, they were more likely to recommend punitive measures. So putting them in jail, prison, to teach them a lesson. And those have real consequences. There are collateral consequences, because once someone goes into jail or prison, they go through withdrawal, and then they end up leaving and they can't find a job, because at every job application they have to check off if they've ever been prosecuted for some type of drug offense, and it makes it really difficult.
Well, it's interesting because I would think, and Matt, you jump in on this, if you hear the word a substance abuser, suggests somebody who's chosen to do something inappropriate, their own volition, basically you chose it, okay, you deal with the consequences, as opposed to a substance disorder.
We're starting to understand that substance use disorder is a chronic relapsing disease, kind of similar to diabetes or asthma, where you can be on the proper treatment and things are going great for you, but there may be moments in time where the environment changes. And because of that, you have a recurrence of symptoms, which is a relapse. Yeah. So that happens in diabetes, that happens in asthma. So why are we using different language to treat substance use disorder as we do these other chronic conditions?
There's so much more we could talk about, and unfortunately we don't have time to do all of it, but maybe we'll talk again some more. But I do want to ask you about whether you see progress, especially legislative progress.
There are a few things that I thought were good about the legislation. For one, it permanently authorizes nurse practitioners and physician assistants to prescribe buprenorphine, which is a medication used to treat substance use disorder, opioid use disorder. Another aspect is that it actually expands medication-assisted treatment. Something that I think doesn't go far enough is how much they're spending. There's currently $8 billion over 5 years. Sounds like a lot of money. Right. But when you compare it to other public health emergencies that we've had, it pales in comparison.
Yeah. Now, what do you think? I'll give you the last word here. Are you optimistic?
I'm optimistic that we are finding treatments out there that are effective and that get people the treatment that they need and that that are really going to help these people right now. But I am not optimistic about the rate at which we're moving. And I think that it's stigma is what is slowing us down. Has nothing to do with the research. It has nothing to do with the people who actually need treatment. It's simply the stigma that's getting in the way. And I think until we start addressing that and start working with policymakers, connecting them with researchers directly, we're not going to see the impact that we want to see to really curb this epidemic, because we haven't even seen it plateau yet.
Well, our hope is through people like you leading the conversation that we can start to make some inroads into that. So you both be well and good luck. And I know we'll be hearing from both of you.
Thank you so much for having us.
Take care.
Thank you.
A reminder for you, for more information on the Pat Tillman Foundation and the projects that they're engaging in, our guests are also working on, make sure you visit us at metrofocus.org.